Chapter 52 covers urinary tract and bladder drugs. The signs and symptoms of a urinary tract infection include urinary frequency and urgency, burning on urination, and if the individual has acute pyelonephritis or a kidney infection, chills, fever, flank pain, and tenderness. However, in older adults, the only presentation may be confusion or disorientation or other central nervous system effects. So if your older adult suddenly presents with an enhanced confusion or disorientation, always think that an urinary tract infection may be the underlying cause of their confusion. Box 52-1 on page 908 covers drug therapy across the lifespan. Children with urinary tract infections should be treated with a urinary anti-infective, but they may also require an antispasmodic or an urinary tract analgesic. Children with multiple urinary tract infections without explanatory cause should be assessed for signs of sexual abuse. In older adults, the increased risk of renal and hepatic disease increases the cautious administration of these drugs, beginning at a lower dose and titrating based upon the individual response to the drugs. So let's talk about these drugs. The urinary tract antispasmodics include oxybutynin, which acts directly on the smooth muscle in the bladder to relax them. It blocks parasympathetic nervous system and are considered anticholinergics. Therefore, the side effects will be those of anticholinergics, including dry mouth, difficulty emptying the bladder, and dizziness. So giving them to a patient with an obstructive disorder can aggravate that condition. So you need to be careful with patients with myasthenia gravis, glaucoma, or benign prostatic hypertrophy. The tablets must be swallowed whole, but it is also available as a transdermal patch. Remember the signs and symptoms of anticholinergic effects, including dry mouth, and note that you need to remember those kinds of things that you need to do, such as giving the patient some throat lozenges, those kinds of things, or dry, sugarless candy to suck on to relieve their dry mouth and increasing their fluids. The anti-infectives are given to individuals to work in one of two ways. They are used for urinary tract infections, and most urinary tract infections are caused by gram-negative bacteria. So these drugs act specifically to destroy bacteria through acidification of the urine or with a direct antibiotic effect. They work mostly in the urinary tract and have minimal systemic effects. Table 52.2 on page 909 identifies three common anti-infectives. You can give these drugs with food to decrease the GI side effects, which include nausea and diarrhea, and the unpleasant GI effects may limit their usefulness. Phosphosamine can also cause a headache and dizziness. It is a one-dose drug and can only be used in individuals 12 years and older. For urinary tract treatment, you need to encourage them also to acidify food, to eat more acidifying foods, and to increase their fluid intake. The analgesics are used to treat the pain of a urinary tract infection, and pain will lead these patients to decrease fluid intake so they can avoid urination until they absolutely have to go, which further increases the infection risk and increases the retention of that bacteria in the bladder. Phenoxyperidine is a dye that exerts a direct topical analgesic effect on the urinary tract mucosa. It turns the urine orangish red and can also cause GI upset and can cause hepatotoxicity. So patients need to be instructed that their urine will turn orangish red while on this drug because they won't expect that unless you tell them. Renal toxicity is also a problem with this drug, so patients need to be sure to increase their fluid intake. It has a rapid onset and should not be used more than a couple of days, and can be given with food to decrease that GI upset that is common with this drug. Okay, a bladder protectant is Pitocin, and Pitocin adheres to the bladder wall to prevent irritating solutes in the urine from reaching the bladder wall cells. It is used for the bladder pain associated with interstitial cystitis. And because it is a heparin-like drug that protects that inner lining of the bladder, it can increase the risk of bleeding when the patient is given this drug. So the patient must be monitored for petechia or bruising and changes in their coagulation studies. It is given on an empty stomach 1 hour before or 2 hours after meals in order to enhance its effectiveness. Again, monitoring urinary elimination, monitoring the skin for petechia and coagulation studies are very important because it is a heparin-like drug. Let's move to the benign prostatic hypertrophy drugs. Benign prostatic hypertrophy is a common problem in aging men. Since the prostate completely surrounds the urethra, any enlargement of this gland leads to discomfort and difficulty in initiating urination. There are two types of drugs used to treat BPH. The alpha adrenergic blockers, or tamsulosin, and the drugs that block testosterone, finasteride. These drugs are discussed now. The tamsulosin decreases contractions in the smooth muscle of the prostatic capsule, which relaxes that sympathetic effect and allows urine to flow more freely through the urethra. It is used to treat symptomatic BPH and to manage outflow obstruction in male patients with BPH. It can be used also to treat hypertension, but its primary use is for BPH. Patients may develop some central nervous system effects such as dizziness and headache, but the first dose may have an orthostatic hypotension effect, so patients should be taught to change positions slowly to avoid that, and it happens particularly with the first dose. So anytime you increase the dose or change the dose, then the blood pressure and pulse need to be monitored for 2 to 6 hours after that dose, because that patient will again become prone to orthostatic hypotension. Patients should avoid drinking alcohol while on this drug, and they should have their blood pressure checked periodically while on the drug. Any significant changes in blood pressure or pulse should be reported to the primary or to the provider. INO needs to be monitored, and their weight needs to be assessed, and they need to be assessed for edema while on that drug. Another drug that is used for BPH blocks testosterone, and finasteride is that drug. It decreases the prostate size, which helps decrease the urinary symptoms of BPH. This drug can also be used for male pattern baldness. Adverse effects are decreased libido and sexual dysfunction, gynecomastia, and GI upset. Women of childbearing years should not be exposed to semen or to the crush drug to avoid absorption, which would impact the fetus. The patient needs to be assessed for symptoms of prostatic hyperplasia prior to and periodically during the therapy. And at least 6 to 12 months of therapy may be needed before you can see the effects of this drug. Another caution is that individuals cannot donate blood for 6 months after taking the finasteride, as it can the exposure to testosterone blocking effects, and they should not father a child during this time. Please review the critical thinking scenarios and teaching about cystitis treatment and understanding BPH that are important to taking care of patients while on these drugs.